Welcome to Mindfully Integrative Podcast with your host, Dr. Damaris G. Mindfully Integrative is a podcast discussing ways toward mindfully incorporating integrative health into our lives. This podcast will have informative resources, fun topics, interviews, and discussions relatable for today with a true mindful perspective in a mind-body, holistic life approach.
Hi, how are you? This is Dr. Damaris Maria Grossman. I'm your Integrative Family DNP, and I'm here to kind of chat with you and mindful awareness, public health initiatives each week or month. And this week we're talking about diabetes, and coming November month, it is diabetes awareness. And as a public health advocate, I try to do at least a brief review of what the illness or is for an individual, maybe some options, resources, and things that I may use for my clients and patients. So what exactly is diabetes? And then I'll go into what is the diabesity. So there's 3 types of diabetes. So there's type 1, which is, and we're talking about the 3 different types initially, are type 1, type 2, and type gestational. So type 1 is a genetic disposition, and this can be any range of individuals. So it can range from you can start usually at early onset age to later on. And these individuals do not produce insulin for a matter of reasons. Genetic component, injury to the pancreas, genetically, the body does not have the ability to do this. So they will need insulin pumps, and their life from usually an early, even juvenile diabetes around 10, needs to be managed at an early time. This one is helps with being that you need insulin at such an early age, and the onset comes on I would say around 10 years old, give or take. It is manageable, and there has so many effective tools now and technology that can be used so that people can have a really quality life. There's pumps that attach to the body, to the pancreas. There's glucose monitors that go on to the arm so that people don't have to be cooking themselves every day. And so that they also are the ones at the most risk, in the sense of they have to really be mindful of what food, lifestyle management, and foods and therapy. So it's quite important for them to be aware. Now, type 2 diabetes is the most common, and actually it is one that can be prevented. And that's what I'm going to be mostly focusing on today. Before I talk about type 2, let's just generally briefly discuss gestational diabetes. So gestational diabetes occurs during pregnancy for women. And this is not for every woman. Usually it's an elderly kind of, the word elderly is not right. It happens in the period of when pregnancy. So during that time, they go through a fasting glucose, which means they check the glucose levels for pregnant women during their time within child. And if those numbers are quite high, then they will be then placed on some insulin and dietary management. Does this mean because they have gestational diabetes that they will then get diabetes? There has been research that has shown there is a correlation, but that does not mean that the person will develop a type 2 diabetes. They just need to be very strict on what they, just like anything else, lifestyle management, what their exercise, what they're eating, what they're doing for their body. This also has a direct effect on them long term. But the reason it's super important to make sure that they have enough sugar is because they're baby. They have a baby growing inside them. So gestational diabetes, again, can still be caused by high blood sugar. And that sometimes it is just caused in the womb and from, having the birth, having the fetus growing within. And that may be it. Others, it may cause a larger growth of the child. The child may be of a larger size, and when they're born, they may also have some glucose dependencies, but can usually be fixed within that uh, first week of life. Um, the third one that I'm going to talk about is type 2. So most of these, all the information I'm going to discuss with you, I'll give you resources. I'm just kind of going on an overview and the importance of why diabetes awareness and knowing the signs of if you have it and how to really prevent it within your life, because this is preventable. The type 2 diabetes is preventable. And if you end up getting it, it is manageable. Same thing with type 1. It is genetic component. You may have it, but it is manageable. And when you know that you have the opportunity and the empowerment to make change, it's pretty profound. So type 2 diabetes has to do with your body is not producing insulin properly. But that does not mean that it's not producing it. Actually, it's an overabundance. It's actually an insulin resistance that happens within the body, and it's an it becomes overproductive and it doesn't know where to go. So the body then becomes insulin resistant. And what that means is that your body has this inability to get rid of the insulin. And the reason this is a problem is because it doesn't go anywhere. And then it ends up coming and depositing itself in the muscles, in the fat, in our liver, and throughout the body, and causing excess fat. And then we actually have a combination of diabesity, as we call it now. So it's a combination of diabesity and obesity. So there is those individuals, majority of type 2 diabetes patients are overweight or obese and also have diabetes. And the most hard thing with this is that, it's treatable, but we always want to identify it or do the things that are necessary to change. And the most necessary things that you can do is lifestyle management. And initially, prior to getting diabetes, usually when you're talking with your doctor or your provider, you're trying to ask and hope that you don't get into this position. But how can you prevent or at least manage? So maybe you're feeling tired, and in reference to the type 2 diabetes, you want to make sure you're getting tested. You're going for your annual physical, at least with your primary care provider, and you're asking for a glucose fasting and checking your insulin levels 1 or 2 hours fasting. So you're not eating the night before, you're checking to see how those levels are. You're also getting a hemoglobin A1C, which gives you like a 3 to 4 month range of where your sugar levels are. And usually they're saying around 6.5 means diabetes, but pre-diabetes can start as low as 5.4. So between 5.4 and 6.5, that's pre-diabetes in range. So what that's saying is different labs say 5.4, some say 5.7. What that kind of gives you is like a little bit of a red flag. Hey, my diet might be a little off. I might be increasing some insulin within the body. So there is obviously something going on. And it kind of gives you like a little bit of a reset and said, hey, let me just reset here. What would be another step in reversing the diabetes? I don't necessarily fully say reversing, but managing it. Your nutrition. I will say that is one of the most important aspects of diabetes before you're taking a medical medicine approach. There is the medical approach side and the medicine side that I will talk briefly about, and then I will send you resources to excellent providers that are experts in diabetes. But one is eliminating sugar within your diet and simple carbs. Now, I cannot tell you how many people that I've discussed and worked with that do not know how to eat with intention and have whole foods. What does that mean to have whole foods? That means nutrient dense, quality vitamins, nutrient full, and not simple carbs. So not the breads, not the rice, not the high sugars, not the donuts, not the high fats. Those things will just cause and potentiate diabetes. You really want to kind of have a quality nutrients and supplements within the body, like um, alpha lipoic acid, biotin, cinnamon, magnesium, all the electrolytes that your body needs, and then just eating quality whole foods. Now, how do we find ourselves after we've maybe been diagnosed, or maybe we're in this pre-diabetic stage? You then have to find a way to relax. You got to reset and say, all right, I do notice there may be this possibility of insulin resistance. I may have diabetes because my doctor says there's something going on. How do I change that? Now you got to give yourself a minute and take a breath and say, I want to make a change. I want to do something different. So let me relax. And then after that, you got to take action. So between the nutrition, between the right supplements and nutrition and foods, then you got to start moving. You got to get yourself moving at least 30 minutes a day. I would love for you to work every single day, improve and do something. Now, if you can't move every day, can you do at least 3 days a week? And there should be really no excuse why people can't move. Get yourself up, go outside, go to the gym, do what you need. In addition to that, start taking the time to look at what your environment and what you may be exposed to. See if their water that you're drinking is pure, you're drinking more water instead of the sodas and the water, sugary drinks, carbonated things, and you're using the right products and foods for your body. And make sure you just take the time to reset and connect with those and family members when you need some assistance or when you are having some negative or indulging moments where you want to have, let's say, a donut or cereal or bread, and you know it's in excess, and you know that you're already having to take your blood sugar every day, and it's getting to the point where you don't want to get heavier. Reach out, connect with others, family, friends, and tell them that you need some help, some support. And also find other people to maybe work and, work out with, eat better with, motivate each other, find people online, connect, those kind of things. Overall, my main tips for today are just kind of becoming aware of diabetes for this month. I will send you some resources. There's a great NP. She's a diabetes NP. I'll send you her YouTube channel. And there's amazing functional medicine doctors that I follow that have been working in the diabetes and obesity and metabolic syndrome for years, and the tips that they would recommend for most individuals. But I will tell you the things that I've just stated are in my top list before we even go into a medication administration. So sometimes then you have to see how things are. And if the numbers are changed and if they're high, then, then things may have to be adjusted. But I'm here to kind of just bring awareness, bring some guidance into the diabetes mellitus for an individual and type 2 management. And really kind of shining a light on the diabesity, because correlate and they have a lot of issues together, because then they cause a lot of integral parts of metabolic syndrome. And obesity itself causes cardiac issues and a whole slew of other comorbidities. And when you're putting these two together, you have now put in this sedentary lifestyle, poor diet, and genetic components that have just made you not your best self. And I really want each one of you to realize that what you put in your body is a direct reflection of what your life and your health will be. If you have any questions, reach out to me at any time. It's just so important for people to understand that diabetes is becoming like this normal conversation. And more patients are getting it because they're not eating well. And it's something that can be prevented. And yes, food tastes good, but I also want to live longer and I want to have a healthy life. And if I can give people some guidance in some of that and limiting some of those so-called good foods that taste good, just so that they can have a better life, I will. I'll be that person. I'll be there. Because now, even through the research, they've been stating, and I'm going to talk about Alzheimer's on another public health podcast, but type 3 diabetes, they're calling now, because of excess insulin resistance and passing through the blood-brain barrier, they're stating that Alzheimer's can also be triggered with excess sugar. So can you imagine in dementia? So you can cause even more upset within the brain and your body by what you put in. So if that doesn't give you a little bit of a wake-up call, there's many other parts of diabetes that is quite severe. It can cause major health impact and will eventually destroy the microvascular system within from head to toe. So you're talking, that's why the dementia for the vascular system, the vision, people's vision get limited. You have neuropathy within the feet and the hands. There's a lot of kidney issues, liver issues, overall metabolic and insulin resistant issues. So there's a vast amount of complications that can come from diabetes, and it should not be looked as just like it isn't something that we need to be aware of. And I really want those to understand the importance of what your food and nutrition, exercise, and lifestyle medicine, so that you can be the best version of yourself each and every day. Because this is part of when I talk about a mindful life each and every day. You have a good rest of your day. I will put in resources on this topic and those that I've discussed and those that I've recommended. Thanks.
Thank you for listening to the Mindfully Integrative Show with Dr. Damaris Maria Grossman, family nurse practitioner. This podcast is for informational and educational purposes only and is not to substitute for professional medical advice, diagnose, or treat. Always consult your healthcare provider before making changes to your healthcare routine. Make sure to subscribe so you don't miss an episode. If you enjoyed our show, please support us by leaving a mindful review on Apple Podcasts or your favorite streaming platform. Interested in being a guest or more information? Email us at info@mindfullyintegrative.com. For resources mentioned in the show, visit our website at www.mindfullyintegrative.com. You can also connect mindfully with Dr. Damaris on her social media links found on the site. May your strength and peace guide you to find a mindful way every day. Namaste.